Ooh, yeah.
Breathe through your nose. That's perfect.
My back, kind of like over here, has been hurting. Like kind of by where your thumb is.
Okay, so upper back, shoulder.
Yeah. And lower back, actually.
Okay, let's start with the upper back stuff. What is this? Is this like working, desk, texting, sleeping? When does it bother you? Driving?
Kind of just, I guess, chilling. And when I'm just sitting, I notice it.
Okay, so when you're at rest.
Yeah.
All right, that's very typical. It just means that a busy mind, a busy life, and then as soon as you like calm down all the noise, then the signals start to come up and your body's letting you know, hey, we're stressed right here.
Yeah.
All right, I can feel a little bit more on this left side musculature, so we'll see what the spine says too. Tell me about the low back. What's happening there? When do you feel that?
When I'm resting too is kind of when I notice it.
Do you wake up in the morning with pain?
I wake up and go to bed needing to like crack my back. I can't sleep or start my day without like cracking my back.
Do you stretch at all?
No, but I probably should.
Okay, well, don't shit on yourself. No one likes to get shitted on, but that's an easy start. Any headaches?
No.
All right, any accidents or injuries? So I saw you 2 years ago. So
Yes.
since then, has there been any major changes in your healthcare status?
No.
Any hospitalizations, accidents, injuries?
No. Thank God.
I'm going to look at some things standing first, and
Okay.
then I'm going to look at your spine in a gown, and then I'll get you adjusted, okay?
Okay.
Just relax. Good. All right, a little bit of a high right shoulder. Ears look pretty close. Maybe a high right mastoid. Definitely a high right shoulder. Put your hands on, and most likely a high right hip. Feet look pretty symmetrical. A little bit higher. All right, good. Good symmetry in the feet. Keep going.
Oh, okay.
Good. Knees are coming straight up. And then just a little bit of internal rotation on the right hip coming inward. But the foot's not following, so that's definitely a hip thing. And then the left toes are pointed outwards, so there's like a knee version on the left foot. All right, you can stop there. So a right rotation in the hip, you can see it in the kneecap right now. It's rotated internally, medially, and then those toes on the left. So that could mean that the whole pelvis is just like shifted this way, internal rotation on the right.
Yeah.
High right shoulder shows up here too at the level of the scapula. I'm going to measure your pelvis now. You're going to feel my fingers on the back of your hamstrings.
Okay.
Tracing up to the bottom of the glute fold, we're lower on the left. That does not match a high right hip, but that's okay. So possibly a posterior inferior on the left. And then looking at the glute from the top, it's even, so that suggests that there is no internal external rotation, which is good. Right, measuring the rotation of the sacrum. Okay, go ahead and bend forward and touch your toes. Good, come back up. Good, not a lot of movement there. Testing the right side, bend forward. More movement on the right, come back up. So less movement on the left SI joint. So go ahead and close your eyes. Looking for postural sway here. A little bit of lateral, a little bit of lateral. There's lateral back to the right again. That suggests category 2. Okay, you can open your eyes. Can you touch your thumb into your forearm like this?
Oh.
Pain?
No.
Maybe. It's not overwhelmingly hypermobile, but just a little bit. No, I think it's pretty good actually. All right, make a pointer finger with this fist over here. Yeah, we're going to point this right at your SI joint in the sacrum.
Yeah.
Ready? Push here. Good. Now push here. Do they feel the same?
Close, but I think lower I was stronger.
The
Or
first
the
one,
first one,
right?
yeah.
Yeah, your gentle scan. Yeah, there's just a very slight increase in the muscle tonicity here in the right lumbar spine, and then in the left upper thoracic spine. So it's interesting because all your pain discomfort stuff is over here, but your body's telling me it's actually coming from here. So let's do a temperature evaluation. This is very symmetrical. Nice and even from top to bottom. I don't feel any major heat patches, no major cold patches. The Moisture content of the skin is consistent from top to bottom and symmetrical. No excessive dryness or moisture. So nothing crazy going on. I don't expect any disc issues or herniations. No pinched nerves. All right, I'm gonna push a little bit deeper into the spine. Okay. I'm gonna start with the SI joint. I'm gonna lower the waistband just a little bit so I can see the SI joint. Here's SI right here. This is S2. Okay, ready? Left, right. Which one's more tender or same?
I think the right one's more tender.
Yeah, if I come down just a little bit, it's there, isn't it?
The right one.
All right, so that's like S3. How about this? One, left, right, left,
right.
Yeah, so as we get to the lower right SI joint, let's check the side of the sacrum. This is where piriformis attaches. There's a little bit of tension there. Does that feel the same, right, left?
They're pretty similar.
Okay. So it's definitely the joint, not as much the muscle. Let's see what the glutes say. All right, so this left one, huh? Trigger point on the left.
Yeah.
More tender, huh?
Yeah.
Okay, butt. And then a little bit on the right hip there. So just nice little compensation happening here. Okay, any discomfort or tension here?
No.
All right, let's do this. Turn all the way to the left. That feels pretty smooth. Any discomfort there?
Mm-mm.
Okay, let's turn to the right. Any discomfort here?
A little bit.
A little bit on right rotation, but not much. Let's push a little bit deeper into the upper thoracic here, see what this says. A little bit of thoracic lumbar transition here on the right. This is where that hypertonicity is. Good. No postural changes up here though, Emma.
Okay.
Which is good. Levator scapula is even to both sides. We have some trap fibers here that we're going to take a look at. And then it's really just this rhomboid minor right here. Insertion coming off the scapula. We'll check the motion of the scapula. That's all fine. Left. Just a little bit of muscle stuff to work out. We have a couple of adjustments in here to do. All right, we're going to see what the trap tells us about the spine. 1, 2, 3, 4, 5, 6. Yep, I get more on this left side. Ready? 1, 2, 3. This one right here. Tender, right?
Mm-hmm.
Not as tender over here?
Nope.
So we have tender on the third trap fiber. That tells us that the main issues are at T4, 5, and L1. So if we're going to count that out, here's T1, 2, 3, 4. There's T4 and T5. And then also L1. Let's see, here's the SI joint. Here, this is S2. That's 1. L5, L4, L3, L2, L1. These are our primary targets for the thoracic and lumbar spine. See now. Like that guy right there, right? So we have a little bit of T1 too. Right, here's our L4 tender, right?
Mm-hmm.
Left or right?
Left.
Right or left?
Left.
Right, so the hypertonic muscle is on this paraspinal here, but your pain on tenderness at this level of the spine is all on the left. Okay, I'm going to put some magnesium spray.
Okay.
This might be a little cold. Right there, right? It sucks.
Mm-hmm.
All right, I'm gonna do a trigger point on that one glute fiber over here, okay?
Mm-hmm.
All right, let's find it first. Let's see. Tender, right?
Yeah.
Okay, just try to breathe through it.
Ooh, yeah.
Breathe through your nose.
Oh.
Good, keep breathing. Almost there. Right there, yeah. Keep breathing. Good. Not too much over here, right?
No, not as bad as it's tender, but not like that one.
Good breathing. There we go. tight.
Yeah.
Okay, one deep breath. Good job. Good breathing on that one.
Thanks.
Nice gentle breathing. Now, even though we just did all that soft tissue stuff, this trap fiber should still be here. So it was the third trap fiber. 1, 2, 3. Yours is just slightly. It's like right. Yep. Still tender, right?
Mm-hmm.
All right. So I'm gonna work on that by adjusting where it tells me to adjust in the spine. So nice and gentle, Emma. You're gonna breathe in, and then as you breathe out, we're gonna follow the breath. Good, just like that. At the end, we'll give a little push. Let's give it a try. Go ahead. Deep breath in again. Good, and out. Good. Shoulders sinking in, letting it all go. Deep breath in and out. Nice. So go ahead and take a deep breath in, far in as you can go. Keep going. All the way in, all the way in. Let it go. We're gonna have to flip over and get it on the other side. Let's measure it anyway. 1, 2, 3, 4. Still tender, right?
Mm-hmm.
A little better or same?
Better for sure.
All right, it's not done yet though. Okay, nice and gentle. We're gonna bring this over to the side like this, and you're just gonna let the shoulders relax here as much as you can. Very nice, very, very gentle. Bring this guy in here, good.
I think the right.
Right. Okay, so that's pointing to left lumbar here. But what if I put my hand here and then do it again, right? Down, left, down.
The right, still harder.
Still harder, right, left, right.
Left.
Okay. That's adjusted PL for the lumbar spine. We still have to do L1, L2 right there.
Okay.
All right, so do you have any tenderness? Here's the top of the coccyx right here.
Mm-hmm.
Do you have any tenderness here?
Yeah.
Do you have any tenderness here?
No.
All right, so let's work on this ligament right there, right?
Yeah.
Okay, so this might be why. We see that indiscrepancy. Nice, gentle breathing. We're just going to hold this segment right here just for a little bit, Emma, until we feel the tension release. Nice, soft breathing with the shoulders down. Okay, retesting that one segment here. Let's go down to the bottom of the coccyx right here. Okay, this was our non-tender side right there. Left side, still tender, better, same, or worse?
It's definitely better. Just a little bit tender still.
Okay, that's okay. A little bit. Okay, now let's get this SI joint adjusted. Nice and gentle. We're gonna bring the hip down like this. Shoulders relaxing. Okay, nice, gentle. Let's take a gentle breath here. Good, and out. Good. Sinking in the hip. Go. Good. Bring your back. That was nice. Okay, you're breathing. We're adjusting the lumbar here. Good. Gentle, gentle. Oh, there's more. Good. 2, 1. Okay, right there. Deep breath in. Lean back as you blow it out. Good. Lean back. Keep breathing. Keep breathing. Down. All right. Go ahead and turn your head to the right. Back to center. Turn your head to the left. Back to center. Okay, now bring your right ear down to your shoulder. Center. Left ear. Center. Okay, gentle, gentle breathing. Good. Sinking in. You're nice and relaxed. That's perfect.
I needed it. It felt so good. I needed that. I thought it was gonna hurt for a second, then I was like,
Sink in with the breath here. Good, Emma. Good.
that one hurt a little bit.
Really?
Yeah, compared to the other one. I like a good hurt.
Does it still hurt?
No. It was just like I think that one cracked more.
Yeah. It was a little deeper. A little bit. It was more stuck.
Yeah.
And then we'll see what your ankles say.
Oh.
Nice. Nice and gentle.
Wow.
Okay. Starts off with the ileocecal valve. We find this by first locating the belly button. I'm going to touch your belly button, okay? Yours is there, then the ASIS, the hip bone, is here, okay? We start tracing the ASIS up towards the belly button to find the ileocecal valve. Yours is here, right above the appendix. This is the appendix. Here's the ileocecal valve. It's a little tender, right? That's okay, it should be. Nice and gentle. Breathe into your belly here. Good. That's clear. Okay, the next thing is the pyloric sphincter, which we find 2 inches above the belly button. Your belly button is here. 2 inches above the belly button is here. Nice and gentle. It's a little tight up here. You don't have any reflux ever?
Yeah, I do.
Okay, you're eating slowly.
No.
Okay, that's it. That's the key to reflux, is eating slowly, chewing your food, not being stressed while you're eating, and not wearing super tight clothing while you're eating too. You do all of those things, don't you?
Yeah.
Good. Okay, this is a diaphragm manipulation. Go ahead and breathe into your belly. Like, take a deep breath. There you go. That's perfect. Again. I breathe it right here into your belly. Keep going. Okay, a little quieter breathing, soft breathing into your belly. Good, and down. Almost, it's right there. pull it tight. Let this arm relax. Good. Okay, you alright?
Yeah.
Okay, right there. Okay, nice and gentle breathing, sinking in. Good. Take a deep breath in through your nose. Good, and out. There it is. There it is.
Yeah, I feel the blood in my head.
Still kicking, Emma. Alright, how's it feel?
I feel good.
Alright, great. Let's relax here. Terrible?
A little bit.
Alright, go like this. Put your hands on your hips. Good. Push, push. Push. Harder, harder.
I'm pushing.
Okay, a little bit. Good. We're gonna reach around and pull this up just a little bit. We'll say. Good. Gentle, gentle. Oh, there's more. Good.